The Obama administration has decided to delay the so-called employer mandate provision in the signature health care law until 2015. So basically, businesses have one more year before they need to provide their workers with health insurance. The setback could be a sign that more health care dominoes are getting ready to fall. House Speaker John Boehner says it's a clear acknowledgement that the law is unworkable, and it underscores the need to repeal the law. Would you bring an expert panel to you now? Avik Roy is right here. He is a senior fellow at the Manhattan Institute, former healthcare policy advisor to Mitt Romney. Michael Tanner with us as well, senior fellow at the Cato Institute. Amanda Austin, director of the Federal Public Policy for the National Federation of Independent Business. Glad to have you all with us. Thanks for joining. We're going to start with you, Avik. You're right here. What do you make of this? What does this change, this delay?
Well, a one-year delay is not that big of a deal if it's only a one-year delay. But here's the real question. Is it going to be a one-year delay? Is this going to be one of those zombie provisions of a law that it goes on, not being implemented forever? Does it get repealed because now there's a political leverage to repeal it because Democrats and Republicans both want to repeal the mandate? I think that's where the future of this goes. And if we do repeal the employer mandate in toto, or it never gets implemented, that's going to be a huge change to the entire private insurance market because less employers will offer coverage, more people will buy coverage on their own.
So, Michael, I'd like to bring you in there on Avik's point. To his point, let's say at the very least, conservatives hate this idea to begin with and are going to fight. And, of course, we have elections coming up in November for Congress. You're in D.C. How do you see it?
Well, I think this actually makes a bad situation worse. I mean, the employer mandate was a terrible idea, making the cost of employing workers more expensive. But what you now have is a situation where the individual mandate is still in effect. So employers are essentially off the hook. They don't have to provide insurance, but their workers have to buy insurance even if their employers don't provide it, or else the workers get stuck with a penalty.
So basically, Michael, I didn't mean to cut you off, but you're saying essentially the government and business gets a year of, let's say, grace period, but for individuals who have to still buy their own insurance, they're actually the ones getting punished.
Well, that's right, and there may actually be more workers now who have to buy insurance on their own because they don't get it through their employer. Plus, it was that employer mandate, or at least the data collected around that employer mandate, that was the key to getting subsidies on the exchanges. Without that data being collected, which is now going to be postponed for a year, it seems very unlikely that they're going to be able to continue to provide subsidies for people who buy insurance on their own.
Amanda, what does this mean for businesses? What does this mean for workers? Because there's a lot of people who work 30 hours or less. That's part-time. Companies don't have to insure them. So does it mean, as far as job creation goes, that maybe companies just fire full-time workers and make them part-time, and that's a quick fix?
Well, frankly, I don't think this is going to do much to change employer behavior moving forward. As Michael stated, this is a significant provision in the health care law that's going to damage jobs and is going to harm the economy long term. Employers are already planning for the employer mandate, and I think this brief acknowledgement from the administration that they're going to give us 1 year to work out the complexity is really just a simple Band-Aid on a larger problem. Employers are probably going to go ahead and move forward with either reducing their workforce, not hiring, and not investing in their business to comply with this in 2015.
Hey, Amanda, if you say this is just a Band-Aid on a bigger problem, define the bigger problem.
The bigger problem is putting mandates on business. I mean, we all know that when you put a mandate on business, it's borne out through the economy. And this health care law is only going to increase costs for both employers and individuals long term.
One big issue here, too, is if more employers do drop coverage because there's no employer mandate, but there's all these requirements that people buy coverage, Obamacare drives up the cost of an individually purchased insurance. So today, individually purchased health insurance is relatively inexpensive.
And explain why you think that is. The fact why? Because businesses aren't going to be, in effect, bargaining down for lower rates on behalf of individuals?
Well, what's going to happen is there's a tax on high-value employer-sponsored health insurance plans. It kicks in 2017. So it's going to discourage employers from continuing to sponsor coverage. And because health insurance gets more and more expensive every year, people might say, you know what, I'd rather give my workers higher paychecks than pay for their coverage. Let them spend their money on their coverage, especially if they can get coverage through subsidized exchanges through the Affordable Care Act. So all the interactions of these policies are what are important to understand. And if you have a drive towards more individually purchased insurance, in general, it's a good thing. We want people to shop for their own insurance. People shop for their own auto insurance. They shop for their own life insurance. It's not a terrible system, right? The problem is then the Affordable Care Act comes in and also drives up the cost of individually purchased insurance, and that's going to hit people who are under the system where they can't get insurance from their employer. They have to get it for themselves.
But I mean, most businesses...
also remember that
go ahead, Michael.
I was going to say, let us also remember that there's considerable doubt about whether or not these exchanges will be up and running on October 1st the way they're supposed to be. The GAO report that just came out suggested that they don't think these exchanges will be ready in time. If they're delayed, that's still more problems for individuals trying to buy insurance on their own without subsidies, without much choice.
Well, Michael, what you're really pointing to is the fact that 27 states are still in flux. They aren't sure what they're going to do about state exchanges. Amanda, how does that figure into your computations?
Yeah, right. Well, that just complicates things further. And I don't think that you've seen many states who are looking at a reduction in premiums for small businesses and individuals moving forward. So to all the guest points, I think we're going to see an increased cost in benefits. We've got taxes such as the health insurance tax, the new Medicare tax. I mean, we've got a number of taxes on top of an already ever-increasing benefit package. So in totality, I think businesses are going to continue to struggle with offering insurance, and we're going to need to look at ways long-term to drive down costs. But we just don't believe that this health insurance or this health care law really addresses that at all.